Hi, Bill.
Hi, Commissioner. How are you?
I'm good. Sorry I'm on the phone, but better
Oh,
than
that's
not.
okay. We appreciate that you could attend. So,
Multitasking.
huh.
Absolutely.
All right. Trying to think if we could start. We have one, two, three, four for voting members. You would need. Do we have a Dr. Charles? Do we have a quorum? I'm trying to remember. We it was the
Dr. Sherry, Dr. Shet, and a Bob Duncan. We're missing three people.
so we do not have a quorum yet. We need one more person for a quorum.
They did accept
Okay.
Dr. Sheth and Bob Durkin.
Okay.
Okay. Now I know I had he had asked to have a conversation about some dental services for the Board of Health. If he comes in, like have more formal discussion of that. But I really don't want to start the meeting without a quorum unless. But Joanne, can you reach out to Dr. Sheth's what is her name? I can't remember.
I think Kelly. I'll reach out.
Yeah, if you can, because he's usually pretty good at
Yep, and Dr. Kuana is not here as well. I forgot about her.
right, Dr. Krohn.
Yes.
But we do need one more person to have a quorum, because we just need a
Mhm.
simple majority.
Bill, I'll ask an informal question then before the meeting
Sure.
starts. Who we dealing with at Moses Taylor? Who's the contact person there?
Chris Howe.
Chris Howe. Okay.
Yep. Yeah, he's been the one, and so yeah, we'll talk a little bit about that as far as where we are with our temporary clinic and some of the things that are going to be required with that.
I'm still involved at that hospital, so if
Oh,
there's
okay.
ever anything that's needed, feel free.
Well, this
to
may be
ask me.
very timely then. So when we
I'll,
get to
I'll see if I still have
Yeah.
any cachet there.
Sure. If no one else comes on fairly soon, we'll start, and then we can have our meeting, and then we'll just have to adopt at the next meeting when we do have a quorum. We'll hear back from Joanne, hear what she has to say, and then if she said she's made contact, I'll form our decision. I have 6 screens up here, and they're all locked with the exception of Zoom. So if I need to reference anything, I'm unable to right now. So I apologize. Actually, with all this tech, I had to have Joanne print out a copy of the agenda because I'm totally frozen from all the other applications. Dr. Sheth. Good afternoon, Dr. Sheth.
Good afternoon. Sorry, I just got delayed with patients, so I apologize.
Oh, no problem. Well, let's call the meeting to order. And so first up, before we go over, have a motion to accept the minutes. Just like to introduce Dr. Cognetti. Dr. Cognetti, if you say a few words, and then we'll introduce you to the rest of the board.
Thank you. Honored to be here with this group. 35 years as a family doctor. I guess that's top of my resume, and I'll leave it right there. So, any general medicine experience I can offer to the group. I'm still involved with the hospital. I'm director of education, medical education. So I teach the residents and run the noon lectures. So anything at Moses Taylor that I can help with, I'll be glad to make a call and see how we're doing. So
Great.
Thank you for having me.
All right, and then I'll hand it off to Dr. Charles. Have you guys been in contact?
Yes, so my name is Dr. Sabine Charles. I'm the health director for Lackawanna County Department of Health. So welcome and thank you for agreeing to be on the board.
Thank you, Dr. Charles.
Yeah, and after Dr.
Yeah, hi, good afternoon. Welcome, Dr. Cognetti. We are really glad to have you. My name is Dr. Shed. I'm with the Right Center. I'm the Chief Medical Officer here, and it's really an honor to be on this board. And under Bill's leadership, the Board of Health has done some wonderful things, and looking forward to actively getting involved. With the new Department of Health coming up in the next few months.
I don't know, I'll keep on going along the top of my screen. Next up, Commissioner, if you want to just, well, you probably know each other, but
Oh yeah, absolutely. Welcome aboard, and thank you to everyone. By the results of last week, looks like you're stuck with me for another 4 years. So
excellent.
happy to be a part of this group.
We're happy to have you. And Kelly Dickey, if you want to introduce yourself.
Hello. Hi, everyone. I am the Director of Special Education for the intermediate unit and pretty much serve as, I guess, the educational liaison for this group and how things are going to cross over with our local school systems.
All right, well, thank you. And of course, we have Joanne DeMarco, who is lurking in the background and who is managing everything and keeping us on track. You're still there, right? Oh, did we lose her?
Yes, I'm still here and welcome.
Okay. So Joanna's the person to reach out to who she's responsible for coordinating everything, getting all the emails and any kind of documentation that's necessary. So with that, let's say, can we have a motion to accept the October minutes as prepared?
I'll make a motion.
Do I have a second?
I second it.
On the question? All right, all in favor? By saying aye.
Aye.
Did we have ayes on there? I did not hear them. So,
Aye.
all right.
Aye.
Aye.
All right, anyone opposed? All right, let's move on. All right, so update. So Dr. Charles, you want to talk about the last meeting we had with the state?
Yeah, so last month we have a meeting with the state, and so we were thinking about sending our application since we have the lease for the clinic, and we're missing only like one nurse right now, and the workforce development and some other position, like minimal position. So based on what they said, if we don't have everybody on board, we can't send the application, even if everything is already in place. So we need every single position on board before we can send the application, because the logic is they have to do training and they don't want to redo the training. So they want to train everybody at once. So once we have everybody, they train everybody, and they know that they don't need to train anymore. And this is why also they stress on that workforce development coordinator that we don't have. They said is a crucial position for them because that person will be in all the trainings. And once we are up and running, that person will be the one doing the training. They don't want to continue to train us. So this is their main concern right now. We need everybody on board before we can send the initial application.
And so where are we with the workforce coordinator?
We have an interview Friday, so we'll see how it goes.
Right. So and just for review, the reason the state is so adamant on this is that I think they're suffering collectively from PTSD with their experience with Delaware County coming on board. Delaware County was the first one in I think, over 30 years. And we would be the second in that time frame. With Delaware, they experienced a 60% turnover within the first year. And so because of that, they had to do numerous trainings. And because of that, now they are taking a very hard line with us because they don't want to do it again, which I guess is understandable. We also, one of the deficits that we're suffering from is the lack of consistency. So when we first start on this endeavor, till now, we will be going on our fifth team. So there have been numerous changes. So we usually have to tell our story and start almost over. So our person that was assigned to us not even that long ago, Robert Schubert.
Yes, Robert Schubert.
So he has been with us for a few months, and he is now leaving to move on somewhere else. So we will be getting a new person. And so that with each new person, there are usually new expectations. And so hopefully we will have some consistency. The biggest issue, as Dr. Charles said, is we have to have everything ready to go. They actually introduced a pre-application almost assessment, which they didn't have before, which we're not pushing back at this time. It's not statutory. It's not even via the forcible bulletin, has not. So this is really a policy that should have become burdensome. I think that we would have to look into that. But ultimately, though, I think that our relationship with the state is good. That we're on track. I mean, we are doing very well. So we have the construction is moving at a pace that well, we'll cover that in a little bit, but we've reported to the state that we are on track with everything else. The nursing hires, which were our biggest fear as far as whether we're going to be able to do that, as Dr. Charles indicated, we just need one more, and then we'll be that part will be to hire. I mean, ready to apply. Which then leads us to the temporary clinic lease, which the commissioners did approve, and it has been fully executed. So it's been actually fully executed effective November 1st. There are some issues with that. One, the state, after initially saying that they don't see any problems with it, etc., that we're good, don't like the location of the bathrooms. We can't change the location of the bathroom. So we are going to offer a solution in the terms of a locked sample drop box for sample. So when a patient goes into the bathroom, they will be able to open lid. They won't be able to access any, drop it in there, and nurse will come in and take that out. They're afraid that the client would have to walk approximately 10 feet into the clinic, and that would violate their confidentiality. So we will offer this as a possible solution. And hopefully we could get that up and running. We will be putting up a bid for the vaccine refrigerators. Now, after being told numerous times that we had to have separate refrigerators, they did. We are now being told, and very happy that we only are required to have one vaccine refrigerator and one freezer. And so we will be putting that out for bid. So, and last, they actually did put in the negative pressure system, I believe, a temporary one. So that's excellent. And we thank Moses Tiller for that. They did agree to leave some of the equipment behind, but they moved out the exam table that they originally were going to leave. So we're going to ask if that's a possibility that they can, because we anticipated that for those two exam rooms that we didn't have to order anything. One was being fully donated, a full exam room donated from a nursing home that was our assisted living. I can't remember which that was going to provide us with their equipment since they've closed their clinic. And then the last one that Dr. Charles informed me is that the door doesn't lock.
Yep, the front door doesn't lock. It doesn't have a lock.
So, which is problematic in that that it has public access, and so we have a correspondence. Did you send it to Chris Howell for that?
Yes, I sent him an email, so I'm
Okay.
waiting for his answer.
Let's see if we could resolve that, because obviously we don't want expensive equipment in there and have it open to the public. So when we're not present, obviously when we're present, that's different. So that's where we're at with the temporary clinic lease. Any questions?
Nope.
All right. Now, the update on the clinic space in the lower levels. They are moving very quickly. So quickly that when I wanted to see if they could save the one closet, and they within a couple of days of starting, I had assumed that they hadn't gotten to the demo, and in fact they had demoed the entire area and have most of the studs put up in the throughout the first and the floor and the basement. So with the right center moving into on the left side of the building, that's almost fully framed out. And the tax office will be going on the other side to take advantage of the drive-through and try to help our aging population with being more efficient and in-person payment of their taxes. We've recognized during COVID that the most vulnerable population we're stuffing into elevators and standing in lines that were wrapping around hallways and in close contact with each other, because it's a certain population, our aging population, is not fond of using online services, and so they want a receipt handed to them and they want to do it in person. So we will have they'll have the counter space down there, and that will be separate. And so one of the areas that we had discussed in the past was the state wasn't crazy about having a sheriff with a metal detector, et cetera, right in the front. It would discourage our target population. One of our target populations being new immigrants that coming in, the independent of their immigration status. We still need to provide them services in order to stop the spread of disease and diagnosis, such as tuberculosis and other things that are more common with some of our new arrivals. So the sheriff will be present, but will be behind the glass and will be exclusive to the tax office. Obviously, if there's a need for assistance, we would buzz them, and we'd have close access to them. So that'll work out well. And as I said, the basement, originally the estimate was somewhere about a year to do all the construction. Part of it was supply chain, which does not seem to be a huge issue at this point. All of the sanitary cuts for plumbing, et cetera, have been made, fully studded at this point, and so they'll be continuing to work. Our tax office, for instance, will be open right after. Commissioner, correct me if I'm wrong, I think the target was right after Thanksgiving.
Yeah,
I think we're on track for that. So it gives you an idea of how rapid. So went from a year build, and it looks like it'll be, if everything continues at the same pace, several months. So we still have not heard back from the state regarding the approval. There was some concerns with the co-location of the Right Center and the confidentiality issues. So most of the confidentiality issues we believed could be addressed. They're afraid if somebody went into the wrong room, that would breach confidentiality. If somebody was passing another patient going to the bathroom, like in the same area, that would be a breach. But we addressed those, and we are waiting for feedback now. And there were some other issues. I think they wanted to know if the separate reception area, which was already in the plan. So We submitted those, how long ago? Was that a month ago? Roughly?
Yeah, a month ago.
All right. So we're hoping to get some feedback on that as soon as possible. We're hoping it doesn't take that long to get feedback for the temporary clinic. So obviously we'd like to apply and start the funding. As we said repeatedly, and Dr. Cognetti, one of the issues with starting a Department of Health, most counties don't do this, is because it is extremely expensive to get up and running because there is no cash flow. The county has to bear the burden of the entire startup. That means all the hiring, all the infrastructure, construction, policies, develop, everything has to be completed before you can even apply. And so currently there is no cash flow. We are able to leverage some retained earnings from human services. We're able to use some ARPA funds that are still remaining. And that's how we're able to fund this. But obviously that's a finite amount and it's not going to last forever. Our balance at this point will be at the end of December, roughly 800,000. We're expending about 30,000 a month at this point for salary and benefits and some other ancillary costs. And so that's where we're at. So any questions? As I've said before, I realize these meetings until we're up and running are going to continue being fairly dry. But once we actually get into the meat of the project and coordinating our efforts and serving the public, the meetings will be very different. We just need to break the plane of the goal line and get our certification. All right.
All good.
Yeah, it is. I don't know if you've been over recently, Commissioner, but I was actually shocked at how fast that they were able. The doors are installed, the interior doors are installed, the separation from the right center and from the tanks, all that's it's completed. Met with the sign people, and they'll be putting up signs relatively shortly. They have to manufacture some of the larger ones, so that may take a little bit. But beyond that, we're going to be good to go. All right, open discussion. Any discussion? Good of the order.
Dr. Cognetti, you're on mute.
You can't read lips? I'm sorry. I saw in the minutes a discussion about prescriptions and the nurse practitioners writing the prescriptions. Will there be any dispensing of medicines there of any kind?
Yes, we will do medication for the STDs. So Dr. Geloli is actually our consultant medical doctor for the clinic, and he is the one who will sign the standing orders. So all the standing orders will come from him, and the nurses will be the one dispensing those STD medication.
For the STDs?
Yes, on the STDs. The HIV will do testing and refer them to the right center or Swinton Primary or any primary doctor that the patient wants to go. We will not do HIV treatment, only testing. We will do STD treatment.
And then tuberculosis and that.
Yeah, and tuberculosis, yes.
TB?
Yes, TB, we will do TB treatment, but we have a TB physician, Dr. Jennifer Joyce. She's already working with the state. She will just transfer to us once we open. Yes.
Okay.
And our population, the TB population, is relatively small at this point. We don't know the scope of the latent TB at this point because the state does not mandate reporting of the latent TB. But in our regulations, we are going to have that so we can get our hands around what the scope of the problem is in Lackawanna County. Now, a lot of physicians do voluntarily report it, but that's what it is right now. It's a voluntary report, so we're not really sure where the scope of this is going to be once it's mandated.
And how about the scope for vaccinations? What populations specifically are we looking to vaccinate?
children and adults, everybody.
Everybody.
Everybody, yes. And it's all free. All mandatory vaccine for the age group are free. The only thing that we will not do for adults is for like the zoster vaccine, a flu, those vaccines are not free. If we have funding, like personal funding, we can fund them, but they're not given free for like from the state. But anything like pneumovax, a diphtheria, all of those vaccines, they will be free for adult and children. All the VFC vaccines are free for children until 18 years old.
And the other vaccines, once we're up and running, we could explore other funding streams. But the volume seems to be very small based on our discussions with the state. I think they said it was 130 some vaccines that they administered over a 2-month period. So now I think what may be different is that our clinic is going to be much more visible. And this is not to denigrate the state, but the location they were given was inside the state office building on Lackawanna Avenue. Most people don't know it exists. We're going to, obviously, this building is very visible. Up until the 17-story building goes across the street and then eclipses ours, but currently it is very visible with the Department of Health and Human Services logo on top. So that may change, just the access and visibility, parking, all those things may change the patient flow. But we're not sure at this point. But 130 is clearly something that's very manageable. We managed that during COVID in a couple hours. So
yeah, exactly. And our goal as well is to do like a lot of education, put the information out there, especially in the minority population. A organization will deal a lot with immigrants and a low-income population. So they know that the clinic is here, it's free. They can come for vaccination, for STD, for HIV, anything that they have, they can come. And our goal as well is to have, referrals for stuff that we don't have, for services that we don't have. So we refer them to those services, like if they have food and security, transportation, anything that they need, mental health. So this is our goal.
And that's why we put it under the Department of Health and Human Services. I think we're the only one in the state that will actually have it that embedded. There's, I think, Montgomery County has that, but it's still a very discrete operation, where ours is embedded. So it literally will be if we identify someone needing other services to address social determinants of health, it'll be right here, whether it's child welfare service, behavioral health services, drug and alcohol, what have you.
Yep.
Excellent.
And then what I would like to do is come up with even more like warm handoffs as far as referrals, because we don't want the patients that we're trying to reach, the population, especially in poverty, their primary care through if they don't have a PCP, they're going to the emergency room, and we've seen that over time too, is for some illnesses, just going into the emergency room. We're trying to combat that and take the burden from the emergency rooms. Say, okay, let's figure out, we can assess, and then we'll make warm handoffs to physicians and have that follow up so we don't lose them. And that would be the goal. But well, our first goal is the certification, so we can do all the good work.
Right.
So
build it and they will come.
Yes, I think so. The education, the other piece too, Dr. Cognetti, we really would like to focus on too is lead. We will be putting the second year of operation, making it mandated. The only other county that does that is Allegheny. We need to, what we've seen statistically, there have been small studies done in the county, in Scranton, I think in particular, and the blood lead levels were very alarming. Are actually recently the department, we received a referral from Department of Health because of lead levels, which was a little strange, that they would send it to us. Now, obviously, if the person it's not going for follow-up, we don't want our young people, or any people for that matter, to be exposed to lead over time because of the debilitating effects that has. And so we are going to be focusing on that. We'll be going to doing presentations in schools. We're going to use this whole year to really educate the community on the dangers of lead, because we have one of the oldest housing stocks in the state of Pennsylvania. And so because of that, we know that we have lead pipes still, we know we have lead paint. And so we are going to provide a lot of education on that, and then we'll have the mandate. So we don't want to make it look like this is the government, we're forcing something bad. We're just saying that we really want to get a handle, give our kids the best chance developmentally as they can have. All right, any other discussion? All right. Do we have a motion to adjourn?
Mhm.
I'll make the motion.
Have a second? Dr. Cognetti? All right, thank you all. And if anything new comes up, we will inform you by email or phone. If not, we will see you in about a month. All right.
Thank you so much.
Okay, thank you. Have a
Thank
good
you.
night, everyone. Bye-bye.